But the fact remains that your government has cut the amount of money being spent on mental health. And so where are the funds going to come from? Where are the resources going to come from to actually achieve this very laudable ambition?
Well, the government hasn't done that, actually. First of all, we've protected funding for the health services in total. It's actually going up marginally through the Parliament. That's a really important step that we took. What's happened around the country is that because people with physical health problems have these rights to access treatment, it means that locally the money flows in that direction. So when the money gets tight, mental health services locally do suffer, and that's why I'm saying we have to move towards giving people entitlements to access treatment. That means building the capacity, you're absolutely right, and it takes time, but I think this is a landmark moment where we're saying there should be parity of esteem between the two. Yeah. We have to build up the capacity so that people with mental health problems get the same entitlement to access.
No, as a GP, I'm just so aware of how much distress there is, and in a recession right now, with people losing their jobs, there is a huge amount of distress and a huge need, and you've identified that need. What worries me is that, is the timing right? 60,000 NHS jobs facing the axe, if that's to be believed. Where are these extra psychiatric nursing services coming from?
Well, the position on that is, overall, we're employing more clinicians. So there's more doctors employed than since 2010.
6,000 nurses, that says.
Well, I mean, one of the things that we're finding is that across the NHS, the way the system works is changing. So people are staying in hospital for much shorter periods of time. 500,000 more people getting day treatment.
So it is true.
Well, I don't know the figures. I mean, what they've done is to go through all local plans. So I don't know whether this will actually prove to be the case. But overall, more clinicians employed and fewer administrators. And that surely must be the right direction.
OK, going to leave it there. Thank you both very much indeed.